Hi everyone, welcome to Dr. Harry's Healthy Corner. This is where we meet each week. It's the lifestyle to talk about lifestyle changes that we can make to improve our health. So welcome. Join us here every week. Welcome everybody. So this week I wanted to talk a little bit about the heart, and there is something called broken heart syndrome. So we'll also discuss that as well, but we want to talk about heart health a little bit this week. So I like to quote this little quote by Helen Keller, and it says, "Whenever we feel something strongly, we feel it with our hearts." So again, we know that instinctively that our hearts ground us in joy, health, and love. We talk about our hearts singing or our hearts breaking. So when we talk about heart health, this is what I want you to think about. I wanted you to think of a healthy heart as a way to experience freedom, joy, and love. So today we're going to talk a little bit about heart health, and join in and ask me any questions that you may have, okay? So we know about heart disease, right? We know about heart disease, and we know that the things that can contribute to heart disease are things like smoking, sedentary lifestyles. We all familiar with that. We know that studies tell us that sitting for prolonged periods of time actually can increase our inflammation, which in turn increases our risk of heart disease. So stress, we know that stress contributes to heart disease. That's chronic prolonged stress contributes towards heart disease. We also know that lack of sleep increases inflammation, increases our weight, increases our risk of diabetes, and that can contribute to heart disease as well. And we know, of course, there's some genetic components to heart disease, but many of us can reduce our risk from heart disease with some lifestyle changes. We know, of course, dietary things can contribute. We know that high sugar diets, we know that trans fat diets, we know that diets that are low in vegetables actually can contribute towards heart disease. And when we say heart disease, this is what I'm talking about. I wanted to clarify this a little bit. I'm talking about coronary artery disease, which really means that inside of the arteries start getting blocked off, right? So blood flow to the heart. Yes, the heart does feed itself. That's how amazing it is. So blood flow to the heart actually gets interrupted because the arteries start narrowing, right? And so the artery starts narrowing, and sometimes it's because of inflammation, and plaque gets underneath and starts narrowing the arteries. And then when the blood flow is constricted, heart does not get oxygen, and so that's what causes a heart attack. Now, what about broken heart syndrome? What is broken heart syndrome? Do you know that our hearts can literally break? So broken heart syndrome tends to occur when there's an intense emotional or physical event or condition that causes a flood of stress hormones to be released just suddenly in the body, and it literally stuns the heart. And the part of the heart that pumps the blood out to the rest of the body, that part actually gets weaker and bigger, and therefore is not able to pump blood out to the body. And many times we experience similar symptoms with that. So there may be chest pain and shortness of breath and all of the symptoms that are experienced. But the interesting thing here is that the rest of the heart works perfectly fine, and there's usually no blockages in the arteries, or there's not significant blockages in the arteries, so blood flow is fine, but blood flow going out of the heart becomes a problem. So when we hear of people who suddenly suffer what appears to be a heart attack because of a bad news, then it might be secondary to that. So some of the things that can trigger that, of course, are sudden death of a loved one, sudden and huge financial loss, or financial gains. Sometimes the shock of winning the lottery and millions of dollars can sometimes put us into a little bit of that broken heart syndrome. And we also know that surgeries, car accidents, anything that triggers a sudden response can absolutely then lead to what we call a broken heart syndrome. So as you see, it's a little bit different than coronary artery disease. So these are two things that can significantly impact the heart, and two reasons perhaps why stress management is so important. Now, of course, we have no control over things that suddenly happen to us, but perhaps we might have a little bit more reserve in order to deal with it. So we talked a little bit about risk of heart disease, and we talked a little bit about broken heart syndrome, and we talked about some things that can really cause the heart to literally break, and we explained the differences in that. So since we know about heart disease and what can contribute to it, what are some of the things that can help to improve heart disease? Well, interestingly enough, of course, you already know some dietary changes can help to do that. And so what I've put up here are some foods for you, and I've kind of listed some of the great properties that these foods may have. So when we're talking about like asparagus, right? Asparagus has a lot of folic acid in it, and so what folic acid does, there's a genetic condition. For some of us, we have this genetic condition, and it shows up more as we get older, and we are unable to make the body use folic acid efficiently. So because of that, we may increase something called homocysteine, which can contribute to heart disease, and asparagus helps us to be able to use to have a lot of folic acid. Foods that also improve heart conditions are things like blueberries. Blueberries are really, really nutritious and has been shown in studies to help decrease blood pressure and actually helps to relax the arteries in the heart. And they're great antioxidants, of course, and we know that's important in helping us to decrease our risk of heart disease. So oatmeal. Well, oatmeal has a special ingredient in it that does help us with blood pressure. We know it has special type of fiber as well that can help us to reduce cholesterol, and things like broccoli also helps us to reduce cholesterol. Is also a great antioxidant. And of course we know of omega-3, which can be found in flax seeds, chia seeds, but also in fish such as salmon and tuna as well. And we know omega-3 helps to decrease inflammation and lower our risk of lower our cholesterol levels and our triglyceride levels, and perhaps then decrease our risk of developing heart disease. And tomatoes have lycopene, and did you know that lycopene was actually associated with decreased risk of heart disease? Isn't that crazy? Oranges has a lot of potassium, vitamin C, and potassium helps us to keep our blood pressure in check. And the dark chocolate is just for me, because I love dark chocolate. And of course the dark chocolate, 70% or above, has more of the polyphenols from the cocoa as opposed to milk chocolate. I'm sorry, milk chocolate fans, but dark chocolate is a little bit better in this respect, and also tend not to use a lot of dark chocolate, because again it's also high in caloric content. Okay, so what we also wanted to talk about here was some lifestyle changes that can help with heart disease. And so we let's talk about some lifestyle changes that can help with heart disease. So things that we want to talk about are things like sleeping. Sleeping is important. Taking up a new hobby, for example, is also important. Did you know that massages have been shown to lower blood pressure, lower heart rate, and decrease our risk of heart disease as well? Taking a vacation is very big in reducing our risk. For example, women especially, let's speak to you for a moment. Women have 8 times, women who only take vacations about once every 5 to 6 years have about 8 times increased risk of heart disease and heart attacks than women who take vacations 2 times a year. So next time you want to think about skipping out on that vacation, remember, it's important to take that vacation. It's important for your heart. It's also important for your brain. Remember that as well. Meditation, that's a big one that's been shown to improve or decrease our risk of heart disease. New hobbies definitely has been shown to do that as well. So these are all some simple things that we can incorporate, and of course we know that exercise reduces our risk as well. But did you know that you didn't have to exercise? Actually, the study shows that light exercise, and light exercise just means keep moving for about 5 hours a day, actually decreases our risk of heart disease by half. So this applies to women as well. So light exercise means the things that you usually do, just keep moving. So a little bit of housework, like gardening, like pulling weeds, playing cards, playing a musical instrument, fishing, because fishing does a lot of this, and so you get some upper body work as well. So the important thing here to remember is that every little step does help. So listening to music, that's a good one. Listening to music has actually been shown to reduce heart rate, reduce blood pressure, and therefore decrease our risk of developing heart disease. So that's important to know. So other things that we want to talk about here is so now that we've talked about a few of these things, can we prevent broken heart syndrome? Well, it turns out we may not be able to prevent broken heart syndrome because, again, it's sudden, and so it's usually a sudden rush of stress hormones in the body that stuns the heart. So the good news is most people recover well from broken heart syndrome, so it's very seldom fatal. Of course, if you follow up with your cardiologist and get proper treatment with that, then you usually recover. And the good news is it's not necessarily because you had it one time does it recur. It can, but it doesn't always happen that way. So the important message here is to watch your stress levels. That's very important. Look at some lifestyle modifications. And if you're experiencing extreme stress, then please seek help, because that's important, right? So that's really what we wanted to talk about today. And so if you have any questions, feel free to email me or Facebook messaging. Until then, please check me out on YouTube, Oasis WERC, and see the compilation of my videos there. And next time we'll talk about self-care and why that is important. Until then, bye-bye.